Thank you for joining us today. My name is Boris Geiser, and I am the Digital Radiography Product Manager for Samsung Neurologica, as well as an AHRA member since 2018. Today, I will be discussing three clinical research studies that have been recently published that pertain to Samsung digital radiography technologies. First, highlighting our SView low-dose image engine, then our bone suppression software as it was used in emergency radiology, and lastly, for our auto lung nodule detection software, which is 510(k) pending and not commercially available in the United States. The SView low-dose image engine was released a few years ago, and Samsung has been busy testing its efficiency in reducing dose in multiple applications. In this study, at Seoul National University Hospital, we tested the image quality of lower dose images as they compared to conventional doses. This study is published in preprint with the American Journal of Röntgenology and will be available in print in August 2020. As an introduction, it is important to understand the clinical implications of dose optimization for pediatric radiography. Although digital radiography provides relatively low radiation doses, pediatric exams require dedicated optimization and exposure control since radiation-induced cancer risk in infants and children are greater than that of the adults due to greater cell proliferation and lifespan. This is especially important in neonatal intensive care units as majority of premature infants in NICU receive repeated X-ray exams. AHRA has been the guiding principle in controlling the X-ray dose, but diagnostic image quality must be maintained even under those circumstances. Samsung's SView image engine uses an advanced feature-preserving noise reduction algorithm that is able to identify the difference between the signal of electronic noise compared to quanta. As the dose is reduced, this advanced denoising engine is able to eliminate the noise from the field without removing anatomic structures which would be critical to diagnosis. As you can see from the image, the middle image, which employs a conventional noise reduction algorithm, has several anatomic structures that were removed, whereas the advanced noise reduction algorithm of SView only removes the noise and not the anatomy. For this study, 40 patients each underwent 3 pairs of radiographic examinations, excluding one patient because of early discharge. As seen in Figure 1, the testing protocol including 3 image pairs. The conventional protocol was based on the existing mobile X-ray system, with Protocol A mimicking that same dose level on the Samsung GM85 with SView. Similarly, protocols B and C then reduced the conventional dose by 20% and 36% respectively. The results of the test are shown in tables 2, 3, and 4, showing the comparison of protocols A, B, and C compared to the conventional protocol, respectively. In every case, the mean score for the anatomic regions were higher than the conventional image. These results showed that at all 3 protocols proved non-inferior image quality, even with a dose reduction of 20% or 36%. The study also revealed that at a 20% dose reduction, or Protocol B, had a significantly better image quality. Figure 3 shows the same patient imaged with the conventional protocol as well as the 3 SView protocols. The patient had a gestational age of 28 weeks and 4 days, a birth weight of 1,170 grams or 2.58 pounds. The images were obtained 6 to 27 days after birth, and images were taken in randomized order. Next, we will discuss the use of bone suppression in emergency radiology, a study that was performed in Asan Medical Center and published in the Journal of Korean Medical Sciences. As one of the most common radiographic exams, chest radiographs are often a screening tool in the emergency department. The experience level of clinicians and radiologists has a great impact on the performance of chest X-rays. Bone suppression is a technology that can complement the limitation of the difference in diagnostic performance dependent on the reader's expertise. The team at Asan Medical Center investigated the added value of bone suppression in detecting subtle lung lesions on chest X-rays with regards to reader expertise. Bone suppression is a Samsung on-device AI algorithm that was trained using a deep convolution neural network to identify and suppress the signal of the ribs and clavicle in the lung field. Bone suppression produces a companion image to a chest radiograph with the ribs and clavicle suppressed from the lung field so as to better identify pulmonary nodules that may be hidden underneath those superpositioning structures. For this study, 160 patients were randomly selected from a pool of 1,600 patients who had undergone chest X-ray and chest CT within 3 days. Of the 160 patients, 80 patients met inclusion criteria in that they were older than 19 years of age and had early-stage lung disease with a subtlety rating of 1 to 3. The other 80 patients had negative findings. The results of the study found that all readers' diagnostic performance increased in chest X-ray and bone suppression as compared to chest X-ray alone. Additionally, the study found that the less experienced readers, Group 2 and Group 4, had a greater increase in diagnostic performance. Group 2 consisted of non-radiology clinicians, such as emergency physicians, and Group 4 consisted of junior radiology residents. The results also showed that detection rates were significantly increased for patients with early-stage pneumonia, metastases, and NTM/TB. Figures 3 and 4 show examples of study cases of pneumonia and multiple metastases. Lesion location and subtlety scores played no difference in the ability to increase diagnostic performance when using bone suppression in conjunction with chest X-ray versus chest X-ray alone. As we were discussing diagnostic performance in the previous charts, we now discuss the diagnostic confidence improvements as well. Table 5 summarizes the pre-regional confidence level regarding the presence or absence of subtle lung lesions. The mean confidence regarding the presence of subtle lung lesions significantly improved in chest X-ray with bone suppression for positive and negative regions. In this chart, figures A and B show higher confidence grades, signified by red color, increased and indeterminate or lower confidence grades, signified by the orange and yellow colors, decreased in positive lung regions when bone suppression was added to chest X-ray. Adding bone suppression to chest X-ray increased association between readers as well, noticed by the reduction difference in height of the arms and the dendrograms. Readers convert the confidence rating in the direction of increased confidence, shown as the blue color, in positive lung regions of figure C, while in negative lung regions, the patterns of these changes were not noticeable. In summary, this study indicates that the addition of bone suppression images to chest X-ray could provide a good method to reduce the impact of clinicians' experience level and increase diagnostic confidence with reducing reader variability can be important for clinicians and residents in rapidly deciding the treatment plan for patients in the emergency department. Lastly, we will discuss a global multi-center study that was performed with auto-lung nodule detection. As mentioned previously, auto-lung nodule detection, or ALND for short, is 510(k) pending and not approved for commercial sale in the United States. A brief introduction to the clinical implications of lung nodule computer-assisted detection. Although lesion detection sensitivity is lower than that of CT, chest radiography is the most common radiology exam. Radiography is difficult to read, however, with up to 90% of missed pulmonary cancer nodules can be found when re-reviewed during follow-up with growth in mass size. Traditional CAD methods have failed to show marked improvement in detection accuracies due to excessive number of false positives. For this global study, we created a uniform protocol for independent data curation and image interpretation between 4 hospitals, 2 in Korea, 1 in USA, and 1 in Germany. The retrospective study dataset consisted of 200 images collected per institution with a 75% 25% split between malignant nodules, CT confirmed, sized between 1 and 3 centimeters in diameter, and normal radiographs without any findings, also CT confirmed within 14 days of initial radiograph. The normal radiographic images were then intermixed with the CT-confirmed positive lung nodule images and sent through 3 tests. Test 1 was with CAD as a standalone. Test 2 was the radiologist interpreting standalone, and Test 3 was the mixture of radiologists with CAD as a second reader. The results showed that on average, the sensitivity of the radiologists with ALND were consistently higher than radiologists by themselves, and the false positives per image were reduced by 10%. The results also showed that regardless of reader experience level, all groups increased their performance when using ALND as a second reader, and on average, the false positives reduced as well, with the small exception that the resident group maintained a somewhat similar false positive per image number. When reviewing the diagnostic sensitivity of different size nodules, both size groups were better detected using ALND. Nodules from 1 to 2 centimeters in size went from 57% to 61.2%, and nodules 2 to 3 centimeters in size went from 75.5% to 81.9%. Locations did not play a role in detection rate, as nodules in all locations were better detected when using ALND as well. Lastly, both primary and metastatic nodules were better detected using ALND. The study also showed a real-life simulation and possible changes in follow-up exams. If ALND findings were directly led to CT exam orders, around 82% of the hypothetically increased follow-up exams would be correctly ordered. This is calculated as the 68 cases that went from false negative to true positive divided by that number plus the 15 true negative to false positive exams. This study was published in Radiology magazine and was editorialized by Dr. Francine Jacobson, following with a press release by the RSNA, as well as a journal review by antmini.com. Thank you for your time. To learn more about Samsung digital radiography products, please visit www.samsunghealthcare.com.